Hello, everyone. Welcome to another TGIF episode of the Anti-Pharmacist podcast. Hope you enjoyed your long holiday because it was a long one, and I hope you are all well rested. Well, it's Friday, and tomorrow is another weekend, so what a time to be alive, really, like literally. Well, recently, if you have a phone and you have been on social media, you know that the news circulating have not been very nice at all. There have been quite saddening situations that have happened over time, and these recent ones have just been jarring. Like it really touched me, and I just feel that it is necessary for me to actually talk about this because it has to do with health. It has to do with care. it's I just feel like it is high time we talked about first aid and basic life support. You see, I feel like in Nigeria, first aid is not something that we take seriously at all. Let's not even go to movie sets or anything like that. A lot of preventable deaths are happening day in, day out, everywhere. An average Nigerian knows nothing about first aid. We believe that it is not our business. It is something only healthcare providers can or should do. I'm too sure that the percentage of Nigerian homes that have a first aid box is very low. I'm too sure of that. If not that regulatory bodies even make it compulsory for factories and production facilities, most of them will not have it. And even now, that is not to say that there are some that still do not have it. You see, the truth is, accidents can happen at any time, and of course it is unexpected. That's why it's called an accident. But not all accidents are inevitable. Some are preventable. Nonetheless, we must be prepared just in case it happens. A little knife cut can become infected, and it can be fatal if proper care is not taken and first aid is not administered on time. A while back on the internet, one video was circulated where two friends were fighting and they cut themselves and it led to death. If basic first aid was known, then maybe that death would have been prevented. You see, we don't have to wait for these things to happen before we take action. We should try and be proactive. Is it schools? Is it homes? Is it workplaces? Everywhere should have first aid boxes. It is for our own good. So if you don't have a first aid box in your house, this is me telling you to get one. And in the next few minutes, I'll be discussing the items you should have in your first aid box and what you use them for. Then I'll also talk about some life-saving and first aid skills worth acquiring, because you may never know when they will come in handy. And lastly, I'll be giving you a crash course in CPR, that is the cardiopulmonary resuscitation. Like I said earlier, first aid can be administered by anybody. Not that, it's only for doctors, so it's only for nurses, so it's only for pharmacists, so it's only for healthcare professionals, so only adults can do it. So nothing like that. Anybody with the basic skills can do it, and it's not something that you have to go to school for years for. No, it's something you can learn in a matter of weeks, even days. There are courses online. So please, let's acquire the skills for our own good. Not everything is energy consuming like that. It requires knowledge. The knowledge that ventilation is important for somebody who has lost consciousness. That alone can save a life. So first, what is first aid? Just like the literal meaning, first aid, it is the primary care, the first care you give, the help you give to an injured person, to somebody who has a minor injury or a major injury or who is ill, to prevent the condition from getting worse, to prevent death before proper medical care is now administered. We are not saying that first aid will replace the services of a medical professional. No, that's why they are paramedics. They do, the first aid before the healthcare professional now takes over. First aid is what you do at that point of the accident, just to stabilize the person before you now take them to the hospital or before you call the attention of a healthcare provider. Do you understand? So the first step in first aid is getting your box. There are different sizes of first aid box. All right, you can get any according to your budget, but there are basic things that must be in your first aid box, no matter how small that first aid box is, and I'll be listing them right about now. The first one is your disposable gloves, because you can't use your hand for everything, especially an open wound. Our hands can carry a lot of germs, so touching an open wound with your bare hands will not be advisable. So you need disposable gloves. It could be nylon gloves and it could be latex gloves in your box. Number 2 is your disinfectant, side your iodine. They are to disinfect whatever wound or your alcohol swab. All right, your methylated spirit or your iodine, hydrogen peroxide, your use solution, just antiseptics generally. They go with your cotton wool, which you use to disinfect the surface that you are administering first aid to, or that you're applying the first aid to. All right, you could use your alcohol swab. That one is already impregnated, like a cloth with alcohol. All right, that's number 2. Then you need your bandages. There's the gauze bandage, there's the crepe bandage. Gauze bandages are usually for wounds, open wounds, scratches, burns, while crepe bandages are usually used for strains, sprains, or swellings, in ankles and knees and all of that. You need that also. Then you need tweezers. Those things that look like two, like a prong. Yes, like a prong, like two long things joined together at the base that you can use your hand to compress. Yes, so you can use those to remove splinters, maybe broken bottles or wood splinters on the skin. You can use that instead of using your bare hands or fingers. Then scissors, of course. You need scissors to cut things, to cut your gauze, to cut your bandage. You need plaster. Once you have applied some bandages, you need plaster to hold it in place. Or once you have applied some things, you need plaster to just close. There are different types of plasters. There are those small plasters for small tiny wounds that are already even impregnated with antibiotics, and there's the normal rolled plaster. All right, then you'd need thermometer. You might want to check temperature of the person. You need a thermometer, digital, clinical. There are many types of that. You need it in your first aid box. You need glucose, just in case of hypoglycemia, just in case of fainting. You need glucose. Those first aid boxes that they carry to fields for inter sports, of course, glucose is usually there for people that need it. Then you need pain relievers, your paracetamol, your ibuprofen, diclofenac, the NSAIDs. They are fast pain relievers. That's for somebody that does not have ulcer. That's why I mentioned paracetamol first. At least that can be tolerated by one who has ulcer. That is if you know the history of this person. All right. So you need pain relievers. At least, with injury comes pain. It is normal. It comes bleeding, comes swelling. Those NSAIDs help. All right. What else do you need in your first aid box? You need antihistamines, the likes of loratadine. All right. Because the person might have an allergic reaction to something. Those antihistamines, they curb that reaction. Do you understand? It's not compulsory that everybody who goes unconscious takes these things, all right? But they just have to be in that box in case they are needed. The same thing goes for your anti-inflammatory drugs, like your hydrocortisone cream, your pain relief cream. I mentioned pain relief the other time. You can have the cream, for sprains and strains. You can use it to massage just before you apply your bandage. Then I was talking about anti-inflammatory drugs, your hydrocortisone, your prednisolone. For somebody who suddenly came down now with an asthma attack, you might include an inhaler just in case, depending on the need, but it's not compulsory. These are just the basic things that I'm mentioning. All right. Then I've talked about thermometer, yes. Then an antacid. It's not bad if you have an antacid. Most people come down with heartburns. They just feel this tightening and peppery feeling in their chest, maybe due to stress and all of that. You can have an antacid. One may vomit. Do you get? So that that reflux will be calm. So you can have any type of antacid in your first aid box. Then you can have a little stomachache medicine like tetracycline or metronidazole, or iocin, that is Buscopan. These are basic things that should be in your first aid box. All right, and keep it in a place that will be easily accessible in case of emergency. In your house, you can have it in your kitchen, because that's where it's most likely that you have an accident, right? Knife cut or something. Do you understand? Somewhere that it will be easily accessible. In your office, a strategic place that everybody will know, so that just in case anything happens, you don't have to travel too far to get your first aid box. And that is it. Now, it's not enough to have these things. You have to know how to use them. That is why you have to acquire the skills you need to administer first aid. It's not somebody should have a cut now and you should be doing something else that could even cause that thing to be more infected. Knowledge is very important. There are too many courses online that you can take about first aid. And this will bring me to the first aid and life-saving skills that everyone should know. I'll be talking about just 6 of them. I'll be mentioning basically. Number 1 is CPR, that is the cardiopulmonary resuscitation. And it's a life-saving skill that involves compressions and rescue breaths to help someone who has stopped breathing. Stopping breathing might be due to sudden cardiac arrest, might be due to drowning, water filling the lungs and oxygen not being able to be taken in anymore. That's number 1, CPR. Number 2 is bandaging. Properly bandaging a wound is important to prevent infection and promote healing. It is important to know different types of bandages and when to use each one. Number 3, burns and scars. They can be serious and they require immediate medical attention, but you must apply first aid first. You understand? Because burns can take lives. You have to know how to properly treat different types of burns to reduce pain and prevent infection. Our skin is the largest organ in the body. Any infection on that skin is a problem. Our skin is really helping us. It's a barrier to a lot of infections because there are many microorganisms in the atmosphere, in the environment. So when there is any cut, any breakage in that barrier, it is very, very dangerous. We must prevent contact of the external environment with the inside of our body, with the inside of our skin. Number 4 skill, choking. It can quickly become life-threatening, so you must know how to clear an obstructed airway with the Heimlich maneuver, and that is crucial. It could happen in children. These children, they could just go anywhere, swallow anything. You must know the Heimlich maneuver. Those are skills that you should learn. Well, maybe on other episodes, we might take this one after the other. But then you can acquire the skills yourself. You don't have to go to any school, like I said. You can acquire this online with certificates. On Monday, I talked about my health, my right. You see, you can help people access their right to healthcare by acquiring the skills, helping yourself and others around you. Number 5 skill is how to take care of fracture. That's the number 5 first aid skill. You have to know how to stabilize and immobilize a fracture. And this can help prevent further injury and reduce pain. And the last one is poisoning. Poisoning can happen from ingestion of harmful substances or inhaling toxic fumes. Knowing how to recognize the signs of poisoning and how to respond quickly can save a life. So next week, Friday, the next TGIF episode is about poisons and their antidotes. Alright? So I've mentioned 6 first aid skills everyone should know. CPR, bandaging, how to treat burns and scars, choking, fractures, and poisoning. Please equip yourselves with these skills. And like I said, lastly on this episode today, I'll be furnishing us with way to carry out CPR, that is cardiopulmonary resuscitation, both in adults and in children. It's just like a crash course. You have to go online, to take the course to get it in depth. Alright? So before I go fully into CPR, in first aid, there's an acronym that is used, ABC, and that is airway, breathing, and circulation. These 3 must be ensured before you can say you have carried out first aid successfully. So it is not ideal where in a situation where somebody collapsed and everybody is just gathering around them to take pictures, to take videos. When I see stuff like that, it is so annoying. Like, the world has become something else. Let me just stop there. But you know what I'm talking about. The first thing is ventilation. Let everywhere be free. Let this person breathe. You are choking them, like literally. It is very important. So you must make sure that they are breathing well. You must make sure that their airways are not obstructed in any way. They must be breathing. Then there must be circulation. Circulation is very important because you know that the blood is the essence of life. It carries oxygen around the body through the heart that pumps and pumps, because once the heart stops, life is gone. So you must ensure circulation. And the basic reason for CPR is to maintain flow of oxygenated blood. Your heart should keep pumping. That's why it's called cardiopulmonary resuscitation. The relationship between the heart and the lungs. Once the lung takes in oxygen, since you have allowed airways to take in oxygen, you have ventilated the area, you have made sure that there is no blockade on the airway, you have made sure that this person is breathing no matter how little, then you must ensure circulation. That's the ABC I talked about just now. Then between the heart and the lungs, that exchange of oxygen is very important for the heart to keep beating and the lung to keep functioning. Then the person will stay alive. After they have come to, after the breathing has been normalized, then you can take them to the hospital. Now there's something called recovery position. If an individual is unconscious but they are still breathing, there's significant risk of airway obstruction. So the recovery position reduces the risk to the patient. So this is how you put the person in recovery position. Whatever it is that is like a baggage on their body, like glasses, like wristwatch, anything, remove them. All right, kneel next to the person and place the arm nearest to you at right angle to the body. Then bring the other arm across the chest. So hold the back of your hand against their nearest cheek, and with the other hand hold the thigh furthest from you and pull up the knee. Make sure that the foot is flat on the ground. Then slowly pull down on the raised knee and roll the body over towards you. Move the upper leg slightly so that the hip and knees are bent at right angle. So this makes sure that they do not roll onto their face. Then gently tilt the head back so that the airway is open. I hope that this is clear to you. So let me summarize basic life support, that is the CPR for adults and children. Okay, one person can do this or two. All right, it majorly involves giving chest compressions and rescue breaths at intervals, alternating them. All right, so if somebody is gasping for breath, do not consider that as normal breathing. Like I said, the aim of first aid is to ensure that there is air, the airway is clear, there is breathing, and there is circulation. If these three things are there, the person is still conscious, most likely not die till help comes, till medical personnel come, or till you take them to the hospital. So this is what CPR is about. What you do is that you apply 30 chest compressions and 2 rescue breaths at intervals. One thing I didn't mention in the first aid box is your CPR mask, because nowadays it may be considered offensive in some areas that you should do mouth-to-mouth resuscitation. They may say you are kissing somebody or all of that. So if you have your CPR mask, this helps you. You don't have to put your mouth directly on the mouth of the victim. You use your breath mask, your CPR mask, place it on their nose and their mouth to cover it, and the hole is where you breathe into. The aim is for you to pass air from your own mouth into their lungs, because they are not able to do that by themselves anymore. And this oxygen you are passing is what the blood takes and carries to their heart for it to keep beating. Do you understand? Chest compressions. You place your 2 hands on the chest, you lock the hands, and you start pressing. This is what you can learn online. I'm sure that there's YouTube videos about CPR which you can learn. The basic thing you have to know is 30 chest compressions, and 2 rescue breaths at intervals. That is one cycle. Once you do 30 chest compressions, give 2 rescue breaths. That's one cycle. Do this in 5 cycles. By then, the patient should have come back to life, should have become conscious. If not, continue, or you use an AED, that is a defibrillator. But I do not expect anybody just passing on the street to have that. It's only paramedics that do. That is why we should have emergency lines to call in case of this. So while somebody is performing CPR, another person is making a call so that the paramedics come with the AED, just for them to be able to detect heart rhythms and know what next to do. Do you understand? So I'll not be talking much about AED. Just that CPR can save a life. So the same thing goes for children. 30 chest compressions, 2 rescue breaths. You can hear some cracking sounds in the chest. It is normal because that is where the ribs are. Alright? But do not let that stop you. Apply moderate pressure. Alright? 30 compressions, 2 rescue breaths. Please go online, go to YouTube, get certifications on CPR. That alone can go a long way. Then on how to apply first aid, on how to treat burns, on how to treat fractures. All of this will be helpful for us. If only one person in an immediate environment has these skills, it will save a lot of lives, guys. Alright, so that's what I have to tell you today. I hope that we can just take this thing seriously and help ourselves and people around us. Okay? Thank you so much for listening to the episode today. And like I said, next week Friday, we'll be talking about poisons and antidotes. Then I'll be bringing a brand new topic about your medications to you on Monday as usual. Please do like, share, subscribe, follow, engage this podcast. Only then can we know that what we are doing actually makes sense. What I'm doing actually has some kind of impact. Thank you so much for your support so far, and thank you for your support going forward. So till next time, stay healthy and God bless you.